Alberta has just controversially announced that they will be introducing a vaccine passport system and be reintroducing a number of restrictions, going into something of a mini lockdown. At least that'll probably be the case for the unvaccinated. The vaccinated will have it a bit easier, although there will also be restrictions on them. And what is the justification for all of this? Why are they going down this route again? Well, Premier Jason Kenney and health officials say the hospital systems are being overwhelmed. They are at risk of collapse because of COVID-19 patients who are in the hospitals, which is the same thing that Canadians have been told in various provinces across the country for quite some time now. That was the justification for previous lockdowns a year ago. Second wave lockdown, third wave lockdown, and so forth. And you go, hold on a second here. You identified this problem, a hospital capacity problem, well over a year ago. And yet a year later, you're still saying, oh guys, sorry, this problem materialized. We got to shut society down again. We got to bring these restrictions in on your lives. Even those of you who did go and do what we asked you to do to go get 2 doses of this vaccine. What's going on here? I remember videos I recorded a year ago, columns I wrote a year ago, chastising Ontario Premier Doug Ford for not doing more to address this issue a year ago because they knew this could be a problem. All the premiers knew this could be an issue about scaling up hospital capacity, that was a thing that was needed to be done. And we talked a lot about the need for beds and so forth, and then we heard, okay, well, the problem isn't so much beds, it's that you got to have staffing resources and so forth, manage the personnel and so on. Okay, well, whatever the details are, I mean, there's a lot of people in the healthcare systems all across Canada who are paid a lot of money, a lot of very high-paid bureaucrats to deal with these very issues that they've known about for over a year now. Now, a number of health officials have talked about how COVID-19 is becoming an endemic illness. And Dina Henshaw, she said that earlier. Now she's saying, oh no, we're not actually at the endemic phase. We got to wait and see. But regardless of what the actual numbers are, unfortunately, COVID-19 will be here to stay for however many years or decades or what have you. So unfortunately, at peak times at least, we're going to have some people in hospital with COVID-19 in perpetuity. They're going to be taking up beds, hopefully far fewer than we have right now, of course. And that's what Dina Henshaw is getting at about not knowing when we're really at the endemic situation or not yet. But come on, you knew that the hospital capacity issue was going to be a problem a year ago. Why did you not do more to solve it then? And I think journalists and politicians who these health officials answer to and members of the general public, they need to press these points more. I mean, if we have a problem here, let's solve the problem. Let's be solutions-based in all of this. I mean, healthcare is typically in every province the #1 departmental expense, the one department that takes the greatest expenses. You've got healthcare and then you got education that usually comes second. We're throwing a lot of resources at it. We got a lot of people who are paid a lot of money. Can we figure this out right now? I mean, can we also just look at the systems and put a lot more pressure on the people managing these systems to deal with all this? Are there different things that should be done in terms of dealing with vaccinations and so forth? Of course. But the idea that this far down the road, shutting down segments of society, heavy restrictions because of hospital capacity issues, which is, what we pay our tax dollars to deal with, I don't know. I think people should just be asking a few more follow-up questions about the rationale and what has and hasn't been done. There's actually been a lot done to deal with hospital capacity in various provinces. They have done various things, but have they done enough? Can they do more? And I think people just need to bring these questions up more. They need to ask these questions and strive to get more answers for them.